Hi Heather, my name is Dr. B. I'm going to be doing a scalp check and skin exam on you today, okay?
Okay.
So I'm just going to ask you a couple questions to start about your skincare routine, about any issues you might be having with your scalp, and just let me know, what you've been experiencing. And then with the exam, if you have any pain or tenderness, please let me know, okay?
Okay.
So I'm just going to start out with a bit of an inspection. Do you currently use any products on your face? Do you use like a toner or moisturizer or anything like that?
Moisturizer, yes.
Use a moisturizer, okay. And how often do you wash your face?
Morning and night.
Morning and night, very good. Yeah, your skin is beautiful, nice and healthy. I'm not seeing too many blemishes. I'll take a closer look with the light and the magnifying glass, but it doesn't look like you have any pimples or lesions or nevi. There's a little bit of one mole on your face right there, a little freckle, but it looks very symmetrical and round. Let me just sanitize my hands really quickly before I touch your face at all. And generally I'm seeing good symmetry in the eyebrows. And if you turn for me here, just checking along the neckline. The hair looks good here. Your skin looks really good. Your pores look pretty small. Do you have any issues with ingrown hairs or acne or anything like that?
Occasionally.
Occasionally?
No.
Okay,
Yeah.
nothing serious. I'm not seeing really anything right now. I'm just going to take a little bit of a look at this one freckle I'm seeing here. Okay. That does look round and symmetrical. Distribution of hair is very good. Your eyelash distribution is very even. Do you have any issues with eyelashes falling out or any growth issues there?
I don't think like a problem, you know what I mean? Just occasionally.
Okay, perfect. And just taking a closer look at the pores. It looks really good, really clear. Just want to take a look with the light. Start on this side. I just want to take a look at your lips. I'm not seeing any sun damage there. A little dryness maybe. Do you use like a moisturizer or a balm on your lip at all?
Yeah, just
over the counter sort of thing?
Yeah.
Okay. Yeah, I think that's fine. If you experience any more dryness, then we can look into something more medicinal, but as long as you're okay. I'm just checking the hairline on this side, looking for any ingrown hairs, any distribution issues. It's very evenly distributed. I'm going to go through and start the scalp inspection now, okay? Because I think everything on your face is looking good.
Okay.
I do feel that you have pretty thick hair. Do you have any trouble with breakage or any issues with your hair feeling thinner or flaky or anything like that?
No.
Breakage at the end looks okay. When was the last time you had a haircut?
A couple of months ago.
Okay, looks pretty fresh and good. We do definitely suggest just getting the ends trimmed off every once in a while, just for healthy growth, encourage healthy growth, but looks really good. So
Okay.
I am just going to start by just palpating your head. Do you have any pain here? Okay. Do you ever have any tingling sensation or numbness in your scalp?
No.
Okay, good. Alright, so first thing I'm going to do is just inspect. That's going to involve me going through with this tool.
Okay.
And checking the scalp itself, as well with a light and a magnifying glass if needed. If you have any pain, tenderness, anything that feels sharp or dull ache or anything discomforting, please let me know right away, okay?
Okay.
The first thing I'm doing is just checking where your natural part is, because that's most likely to experience any sunburning or overexposure. And I'm seeing a little bit darker scalp here, but nothing too bad. Do you often wear your hair back where it's like this? Okay, I can kind of tell that it is covered, full coverage. You're very lucky to have very nice thick hair. And are you always parted in the middle here?
No, I change it.
Change it up. Okay, that's good actually if you can, because that means it's not just constant exposure in one spot. So that's very good. if I'm pulling at all. I'll try my best.
It's okay.
Just do see one nevi right there. I'm just gonna take a closer look at that.
Okay.
You have to be careful about any freckles or moles that are hidden underneath the scalp, because that could be hard to monitor. Well, that one looks totally fine. Symmetrical, no discoloration, the borders are even. I'm also seeing that your scalp looks really healthy and moisturized here. Do you use shampoo and conditioner every day?
A couple times a week.
Okay, good. Yeah, too much is actually going to dry out the scalp, which seems like you're very aware of, so it's good that you take very good care of your scalp. But it's still important to get checks, just in case. Alright, I'm going to go ahead and move on to the other side. I do see you have some piercing. Do you ever have any swelling or redness on the ear in that area of the skin around?
Not in years.
Okay, very good. Looks completely healed. So you've had those for a long time?
Yeah.
Okay. I'm just going to check underneath here. Just tip forward for me just a little. Thank you. I'm going to check one little spot with the magnifying glass right there. So it's a little red. Does that hurt at all?
No.
Okay. It's maybe just a little ingrown hair or something. As long as it's not bothering you, it should be fine. If you start feeling any pain there, you may want to come in again and maybe remove it, but it looks like it probably will just work its way out. Alright, the scalp looked good. There was a couple of those spots that I just want to keep an eye on for next year when you come in for your ERB. I'm just going to brush your hair out, make sure you're not experiencing any hair loss, discoloration. I didn't see any sort of changes with the texture of the hair, but just work some of these knots out. Let me know if anything on your scalp feels particularly sensitive while I do this.
Okay. Actually, that spot there doesn't feel that great.
Okay, let me take a closer look. Maybe I missed something. Right here, you said? Okay, oh yeah. Yep, It looks like possibly an ingrown hair. It could just be slightly bothered pimple or something, a small lesion like that. So let me put a little bit of just cooling cream on that. That will also help soothe the area, open up the pore, let anything come out that we need to. I'm just going to put some gloves on for that. 1 second. Alright. Does that feel okay?
Mm-hmm.
Alright. Yeah, so again, if that starts to feel worse, I think it'll just clear up, but if that starts to feel worse, come back, and I'm just going to be gentle around that part right now.
Thank you.
Mm-hmm. And do you normally wear your hair straight like this?
Yeah, pretty regularly.
Okay. Do you use any heat mechanism, hair dryer, straightening iron, that kind of thing?
Yes.
Okay. Are you using any sort of heat protection after a shower onto your hair?
Yes.
Okay, good. So I'm just going to take one last look and make sure I didn't miss anything. I'm just going to check really quickly just right under here. Skin this around. Alright, well Heather, I think everything looks great. I suggest just coming back in a year for your normal appointment. So we'll see you around this time next year and keep doing what you're doing. If that spot, either the one in the back that I noticed or the one on the side, do start to bother you, give the office a call and we'll get you in, okay?
Okay, thank you so much.
Thank you.